There now for a story from the 12 News I-Team. Retired Phoenix firefighters and police officers are facing huge unpaid medical bills. Why? The company they turn to for insurance isn't paying. The company is called the Thin Blue Line, marketed itself as a more affordable option than regular health insurance exclusively for first responders. But in the last few months has come under fire for delays and failures to pay medical bills. The I-Team's Katie Wilcox sat down with one of the retired firefighters' wives who said their family took out $40,000 from their retirement savings to pay for a surgery for their daughter, thinking the insurance would reimburse them. But as the months went on, it just didn't happen.
It scared me to death. And I felt like at the time that we were alone. This is something that we were going to have to deal with, and fighting an insurance company. It's like, what are you going to do? How could you do that to people that need that type of insurance because of their job-related illnesses and everything they've gone through? My husband has been on high-rise fires. Most firemen are exposed to that kind of dangerous, the chemicals, all of that. And you don't think about that until you retire and realize, okay, you're on your own.
All right, backstory now. I-Team's Katie Wilcox joins us. In this Thin Blue Line, they've got some issues. But let's talk about what this company even is, right? So you've got first responders, generally, I think, is it 20 years you put in or something like that? And you can retire, right? So you're retiring before you're 65. So this company would fill that gap in insurance before Medicare started.
That's exactly the point of this. So they offered what they said was an alternative that was supposed to be more affordable. There are plans available like on the marketplace, the Obamacare or the Affordable Care Act offered individual plans. These guys tried to be a little bit less expensive than that and offer what they called a gap insurance model for people who are, in their 50s before they turn 65, who retired early. But the problem was that they're a self-funded entity. And so right now, the question is really, are they going to be able to pay off these bills? So the big problems that happened in the last couple of months that are bringing this into the news right now, they lost their contract with Cigna, meaning that a lot of people started being told, hey, you don't have insurance, or we're not taking your network anymore, you're not part of Cigna anymore. And then they got a letter saying, hey, we lost this because they weren't paying the bills on time.
Wow. And there's a big federal lawsuit between the people who are running this company, is that correct?
That's exactly right. The founders, so one of the partners of the company tried to leave. He was sued. He countersued, and that's sort of the big crux here, is that that partner was a retired police officer himself who used Thin Blue Line to cover his own medical bills. They weren't paying his medical bills. Now he's accused them of fraud in federal court. So
just like that woman we heard from in the story, what happens to these first responders who basically have dedicated their lives to making sure that we're safe or taken care of, and now are they just left on the hook? What's going on?
Some of them right now are really worried about that because this is a lot of money, and some people are concerned. They've already been sent to collections. Some of the folks that I've heard from, they're trying really hard. And again, Thin Blue Line hasn't spoken to me. They have said repeatedly to their folks, and even in court, that they're going to pay off these bills. But I think people are really concerned. And what we've seen, unfortunately, in the past is that sometimes association health plans haven't been able to come up with the money, and they have had to file bankruptcy in the past, leaving people on the hook for this. So that's what is really concerning firefighters and police officers and those retirees right now. So we're just very hopeful, and like Susan had said as well, just really hopeful they can come up with the money.
Right. And you are soliciting more people to come forward with this?
Yeah, absolutely. You can always connect with us, 602-444-1212, easiest way to text us, and then you can email me as well.
Great. Good job on this, Katie.
Thank you.
Good stuff.